One of the most common questions I get asked is, what is the cost of the consultation, the application and the products? The cost of the consultation, we offer fixed fee consultation so that there's no surprises. It's $199 for the initial consultation, which includes the time with the doctor, making of the application, receiving the application and prescribing the products. And the follow-up appointments for that are $59. That's the doctor's time plus prescribing those products. There are an additional fee if required when you want to try more than one product at a time, or if you'd want a letter to your private health insurance to cover or compensate for it, or a letter to your Department of Veteran Affairs to help cover the cost or compensate for it. So we're quite unique in that we offer fixed fees so that there's transparency in the process and patients aren't getting a consult fee plus an admin fee plus a dispensing fee plus a scripting fee. Those costs can very easily escalate, and unfortunately there's a lot of clinics there that are really, their costs are not very clear, and they can very quickly make it very unaffordable. So that's something that we decided early on we were going to focus on. The second part of the cost comes from the products themselves. So the products themselves, it really depends on three key things. One is CBD is more affordable than THC. That's internationally, that's more commodity pricing. There's a higher demand for THC products and therefore they cost a bit more. Internationally there is a lack of THC on the market, so many overseas countries are producing their products to send to higher value countries such as Germany. But here, if the CBD is more affordable than THC, and then flower will be the more expensive end of the THC. So bearing those three in mind, the average price per product per day for CBD would be approximately a coffee, so about $4 to $4.50 a day. At the higher end for THC oils, you'd be looking at about $6 to $10 a day, and for flower it can be upwards of $10 a day. So I often tell patients that works out at about 1 coffee a day if you're taking CBD, and 2 coffees a day if you're taking THC oils or flowers. I know that can be a very high amount for people. These products are not cheap, they're not funded by the PBS. Indeed, if we got the funding that many other companies do, pharmaceutical companies, these products would be costing cents on the dollar too. So it's important to bear in mind why those costs are very expensive. As I alluded to earlier, the prices, commodity prices on the market and where they can send it internationally to make more profit margin, and then 2 being really the idea of what the level of THC is in the product. And that's a big difference between those prices there. However, many of our patients, and we have over 2,500 patients, are finding that a coffee to 2 coffees a day is the average for them. In terms of our patient demographics, about 60% of our patients are on CBD alone, so that is quite an affordable cost for them of about a coffee a day.